Grey's Anatomy Season 21, Episode 11, Is Transplant Surgery a Success or Disaster? Grey's Anatomy Season 21, Episode 11 features one of the season's most difficult and heartbreaking medical situations, as Tasha and Lisa's transplant procedure finally goes into place. With emotions high and many lives at stake, Grey Sloan's doctors must collaborate in a sophisticated and risky treatment that might change everything. The surgery begins. Can both lives be saved? The episode begins with Meredith, Nick, Bailey, and Richard preparing for the high-risk split liver transplant. The stakes are extremely high. Tasha, Evyn's wife, is suffering from Alzheimer's and requires 2/3 of the donor liver, while Lisa, a librarian with a failing liver, will receive the remainder. While the plan is innovative, it has significant risks. Any complications could result in the loss of one or both patients. As the surgery begins, the team faces an early setback when Tasha's body exhibits signals of rejection. Bailey and Richard rush to stabilize her, while Nick and Meredith continue with the delicate liver excision. Meanwhile, Ben, who has been struggling with his internship assessments, steps up at a critical moment, confirming his worth by detecting a small but life-threatening clot growing in Lisa's donated liver. His rapid thinking impresses Bailey, implying that he may finally be settling in at Grey Sloan. An emotional roller coaster for Evynn and Lisa's families outside of the OR. Emotions are running high. Evynn is beyond herself with fear, knowing that even if Tasha survives the surgery, her Alzheimer's disease would continue. She has a sorrowful talk with Simone about how terrible it is to watch someone you love pass away. Simone, who has been personally affected by her grandmother's battle with the disease, offers comfort and a reminder that love is what matters most, no matter how long they have left. Lisa's family, on the other hand, is cautiously optimistic, albeit the future is uncertain. While she made it to surgery, her poorer condition makes post-operative recovery extremely difficult. Joe and Link, who had recently discussed their future as twin parents, are deeply invested in Lisa's case. Their developing emotional connection to their patients demonstrates how much their personal and professional lives are beginning to overlap. The aftermath is a success, with uncertain consequences. After hours in the operating room, the surgery is finally over. Tasha and Lisa both make it through, but the prognosis is questionable. Tasha's body initially responds well to the transplant, but the presence of Alzheimer's raises concerns about the procedure's long-term effects. Lisa, on the other hand, has an uphill battle as her body tries to adjust to the new liver. As the episode concludes, Meredith and Nick get a quiet moment to reflect on the day's events. While they have saved 2 lives, ethical doubts about the decision to proceed with the transplant remain. Meanwhile, Joe and Link discuss their future. Seeing Lisa battle for survival reaffirms their commitment to provide the greatest life for their children. With the transplant success on the line, Grey's Anatomy lays the setting for an emotional follow-up. Will both patients make it through recovery? How will this event affect Joe and Link's future as parents? Will Ben's heroics ultimately earn him the recognition he's fought for? Thank you for watching.